Hi everyone, my name is Dr. Yusri and today we're going to be speaking about weight loss. So just some weight loss terminology. Overweight is defined as an individual who is over the normal weight. It's defined by the mass body index, which is calculated per individual, or BMI. Overweight can lead to obesity and severe obesity, which is defined as a BMI over 25. As you can see on the slide, overweight is a BMI over 25, obesity is a BMI over 30, severe obesity is a BMI over 40. Unless the patient does have a presence of comorbidities, it's lowered to a BMI over 35. Just some background why we're speaking about this. The CDC estimates over 70.7% of adults and 34% of children are overweight or obese. Being overweight puts a person at increased risk for various comorbidities, including hypertension, diabetes type 2, stroke, coronary heart disease, and more. This is why a lot of patients seek for weight loss. They seek weight loss through lifestyle management, whether it's through decreasing caloric events, increasing energy expenditure like exercising, or even alongside medication and lifestyle to prevent future health issues. So initially, when a patient comes in prior to starting a weight loss treatment, you want to evaluate the patient as a whole by looking at their past medical history. You want to see if the patient has any underlying comorbidities or physiological factors that can be contributing to the weight gain. If recognized, you need to manage these underlying comorbidities or physiological factors first before initiating weight loss medications. Some examples of physiological factors include increased stress, increased workload, and some underlying comorbidities include heart failure, hypothyroidism, insomnia, depression, Cushing-Gold's disease, or menopause. These are just some examples to keep in mind. Also, there are a lot of medications that can cause an increase in weight gain. So some include antipsychotics like clozapine and olanzapine, diabetic drugs, insulin sulfonylureas, divalproex valproic acid used for seizures, lithium used for bipolar disorder, steroids. So the thing with steroids is if a steroid is utilized only for around a week or 2 weeks for short-term management, it will not have an increase in weight gain. But if a steroid is used for a long period of time for multiple months, which is commonly used in things like lupus, to help with the inflammation, this can cause an increase in weight gain. Tricyclic antidepressants, hormones like birth control, and SSRIs like paroxetine are other examples. What medication can cause weight gain? What I used to create this slideshow was the most recent guidelines. So the guidelines from the American College of Cardiology and Task Force for the Obesity Society, as well as the American Association of Clinical Endocrinologists and American College of Endocrinology Obesity Guidelines. Before treatment, there's some things that you need to consider when looking at a patient. There's some barriers to care, including the low-income household, poverty, long distance to grocery stores, homelessness, underlying medical issues, or insurance. So a lot of patients may be obese or overweight due to the lack of these common necessities that individuals may have that others may not have. For instance, a lot of foods such as vegetables, fruits, and healthy types of snacks tend to be more expensive than cheaper type of snacks. It may be a better cost choice for a patient to get a burger versus getting a box of strawberries. In the case of poverty and insurance, that's another reason why. So if patients again have a low income or do not work as much and do not have enough money, they tend to also have low amount of money to spend, and to them, food may not be one of the priorities to get something healthy. Another thing to keep in mind is long distance to grocery stores. Some patients may live very long distances from local green farms or markets, and this causes them to go to more of the fast food restaurants around them since it's more convenient.